Okay, well, let's talk about one of the other benefits of muscle and of exercise training on that muscle. So this is a study conclusion. The findings of this study indicate that regardless of exercise duration, length, and type, whether it's short or whether it's high intensity or aerobic training, both significantly increase your serum nitric oxide levels. Why is that important? Let's take a look at what nitric oxide does. So this is just one element here. Nitric oxide has all of these potential beneficial effects. Number one, it improves inflammation. Number two, it improves neurochemical function for cognition and for nerve communication. It has bone parameters where it helps with bone maintenance. It kills tumor cells. It tones blood vessels, helping them dilate properly. It inhibits platelets. So it prevents platelets from making your blood super sticky and thus reducing the risk of things like heart attack and stroke. It has impacts on sperm and on egg production and reproduction. Apoptosis, it helps kill cells that are old and are ready to die. It helps build new blood vessels. That's what angiogenesis is. It helps with oxidative stress, and it biofilm and inhibits. And biofilms are something that are formed largely in the nasal passages. You can get biofilms in the GI tract, but what happens is the wrong kinds of bacteria, when they start colonizing your gut, they make these biofilms. They're like shields that protect the bacteria, and then these bacteria start living in you, and they're producing all kinds of toxins called lipopolysaccharides, or LPS toxins. And then those toxins can cause fatty liver disease and arthritis and all kinds of problems. So nitric oxide helps prevent those bacteria from getting a foothold. And then we know it also has an effect on cardiovascular homeostasis. So exercise. I mean, if I haven't shown you enough so far to convince you that exercise is probably, if you watch my episode on the sun and on the sunlight as free medicine, on light as medicine, I'd say the combination of this, exercise, and sunshine are the two at your fingertips, actionable things you can do right now today that have a tremendous, tremendous impact on the overall health and outcome. Okay, let's talk about some nutrients. If we're trying to build muscle, lean mass, and we're trying to exercise and get prevent soreness, then there's some key nutrients that are going to be helpful for that. And I want you to have an understanding of what some of these are. So let's blow that up a little bit. So, and not necessarily in order of most important to least important. And this is also not a comprehensive review of all the nutrients that play a role in recovery from exercise, but these are some of the key ones. So we'll start up at the top. These two groups here, leucine and isoleucine and valine, these are called BCAAs. You heard me make mention of BCAAs earlier, branched chain amino acids, BCAAs. What do these do? So leucine, it's the primary on switch for muscle protein synthesis. So if you're trying to recover, let's say you're under eating protein. Maybe you're somebody following a plant-based diet. Maybe you're somebody that's just, your stomach hurts a lot and you're not eating enough food because you feel better when you don't eat. Look, if you're going to start exercising, you need to make sure you're getting branched chain amino acids so that you can recover, especially if you're under eating. And one of the things we see, especially in the elderly, I told you earlier that term that's being used, sarcopenia, where they're blaming age on muscle loss. It has nothing to do with that. It's bad nutrition multiplied by sedentary behavior over time causes muscle loss. And the only way you reverse that is eat enough protein in your diet, combine that with activity. And if you eat enough protein, you're going to get these branched chain amino acids. The leucine, the isoleucine, and the valine are in the protein that you eat. But they help build your muscle, and they help maintain your muscle, and they help your muscle repair after exercise. This is an old bodybuilder trick. Bodybuilders take these things on the regular to reduce the muscle soreness. So if you're scared of muscle soreness, consider BCAAs as a way to support that. Lysine, and you can go back and watch my crash courses on these amino acids as well. We have crash courses on them. But supply building blocks for collagen and elastin and connective tissue. So again, it's important that you have adequate lysine for the connective tissues that help your muscles stretch and elongate and contract and relax. Methionine donates methyl groups. If you've ever heard of creatine, you can watch my crash course on that too. But methionine is one of the key ingredients for making creatine. You make your own creatine if you have enough glycine and methionine. And so at any rate, it's one important one. And remember, creatine helps to grow muscle and helps you exercise. Arginine helps to make nitric oxide. What are we just talking about? Nitric oxide. This helps to deliver blood flow to your muscles and better nutrient delivery to your muscles so that they can perform. Glutamine helps to repair muscles. This is one of the key ingredients. If you want to reduce muscle soreness and recover faster, glutamine probably one of the most effective in that regard. I mentioned before creatine from other amino acids. So glycine, arginine, methionine help to make creatine, which replenishes energy in your muscle, which is going to be an important component of exercise, especially those of you that are more tired. And if you're struggling with fibromyalgia or chronic fatigue, creatine can be a complete game changer for your ability to start exercising. Zinc, more than 300 enzymes involved DNA, RNA production and muscle repair, modulates insulin and testosterone. You can't make testosterone without zinc or insulin for that matter, and insulin-like growth factor. Magnesium is required for the energy, so for your body's ability to make ATP, which is the primary energy for muscle contraction, you need magnesium to do that. And of course, exercise can cause a depletion over time of magnesium, so this is going to be an important one. Iron, which is the primary mineral responsible for hemoglobin and myoglobin. Hemoglobin carries oxygen. Myoglobin also carries oxygen, but myoglobin is specific to muscle cells. So your muscles need myoglobin to make sure they have enough oxygen to sustain exercise. Otherwise, what happens is your muscles burn really, really fast and you can't do much exercise if your iron's low. Vitamin D binds vitamin D receptors on muscle fibers to enhance calcium. Remember, calcium modulates muscle strength, contraction, and relaxation. Calcium drives the contraction. And when you add it to phosphorus, it helps to anchor tendons and maintain bone that resists muscular force. Vitamin C makes collagen strong, helps them repair, helps them regenerate. B complex, all the Bs are responsible for modulating these amino acids, but also for producing energy and for driving the process of energy production in your mitochondria, which aids with your exercise. Omega-3, very important. It's part of the membrane of your muscle cells, and it's very important in regulating the inflammation. So if you're exercising and getting sore, I mentioned omega-3 earlier as far as like reducing soreness. Potassium and sodium are the electrolytes that are necessary for the nerve impulses and the muscle contraction. And so if you're super dehydrated, you can get muscle cramping and have muscle aches and pains. So many of you have avoided salt, sodium especially, because the doctors are all saying that it's evil and it's bad and it causes high blood pressure, and so everybody's avoiding it now. But you need it. You need salt, you need sodium and potassium. So if you're having cramps, you might think potassium, sodium, you might think magnesium, you might also think calcium and phosphorus. Those five minerals are some of the most important for prevention of cramping. And then selenium. Selenium is a very, very powerful mineral antioxidant that regenerates glutathione, which is very important for recovery of muscles and for the growth of muscles. So these are all, again, not an exhaustive review, but all just key nutrients involved in muscle health and enhancing your exercise. So if you're going back to if you're scared of the soreness, consider using some of these different things in your workout routine to reduce that and recover more quickly. Let's talk about some strategies to start building lean muscle. This is not rocket science, folks. It's just movement. Play like a child would be one of the best strategies, but let's just go through this. So progressive strength training. This is, 2 to 3 sessions a week. This would be where you're lifting some type of weight, right? So it's multi-joint moves, 1 to 3 sets of 8 to 12 reps, 70 to 85% of your maximum weight. And you can add some weight every week as you get stronger. Don't go into this too quickly. This part you really want to err on the side of caution. Go lighter as opposed to heavier if you haven't exercised in a really long time and you're new to this. And that's true with any exercise. Start slowly. You can always add next time, but trying to get an idea and a feel for where your body's at. We've all heard the term weekend warrior. Don't go into the gym if you haven't been in for 10 years and be that weekend warrior that injures out on the first workout. Because that's really gonna create a problem. But low volume resistance training boosts muscle function in adults with heavier loads giving extra strength gains. 2 workouts a week is what we're talking about, and the sessions can be 30 minutes or less. It's not a big, huge commitment. Protein priority: 1.2 to 1.6 grams of protein per kilogram of lean body weight per day. Now, if you're 300 pounds overweight, you don't use this formula. This formula is based on what your ideal body weight should be. So if you're super, super heavy, if you're 100 pounds overweight or 50 pounds overweight, this isn't the right formula. You want to take your ideal body weight and calculate this formula in. Distribute 25, and a good general rule of thumb is get 25 to 30 grams 3 meals a day, at 3 meals of the day, and you're going to hit somewhere in the 75 to 90 just from protein. And then when you add other foods, and I'm talking about animal proteins, and when you add other foods to that, you have, there's some protein in nuts, there's some protein in vegetables as well. Now, if you're going to use whey, I would recommend, if you're gluten sensitive, not to use whey. But if you're going to use it, I would recommend that it's a clean version, A2. Whey has really great muscle building properties if it's a healthy version of whey. A lot of those protein powders you buy over the counter are junk. They're highly processed junk whey, and I don't really recommend those. So if you don't have access to good A2 grass-fed, don't bother with it. Instead, go with other meats. And this could be beef. Red meat doesn't cause disease. Red meat is good for you. And it doesn't mean you have to eat, 20 ounces of red meat at every meal, but it is good for you. And I know it's been demonized over the last many years, but you got to get protein. If you're going to go in and you're going to get stronger and you're going to build some lean mass, you need the protein to heal and repair and build that tissue. Higher daily protein and per meal leucine threshold, overcome age-related anabolic resistance and add lean mass. And where we get that leucine is going to be in animal meats. Creatine monohydrate, 3 to 5 grams a day, paired with training blocks, and make sure you stay good and hydrated when you're using it. But meta-analysis show creatine plus resistant training amplify strength and fat-free mass across midlife and older people. So it works in older people as well. Stay vitamin D repleted. Don't let your vitamin D get too low. Aim for a serum vitamin D of really, I'm going to make a correction here. This really should be 50 to 100. And if you're there, great. You don't need to worry about supplementation. If you're not there, consider. Let me make a dose adjustment here. 2,000 to 8,000 units. But you really should be trying to get that sunshine too. I mean, the sunshine is going to be an important aspect here. But we know that supplementation improves lower body strength and power. I mean, one of the side effects of vitamin D deficiency is muscle pain and weakness. Sleep 7 to 8 hours a night. You gotta sleep to recover. Consistent bedtime, cool dark room, limit blue light an hour before you go to bed. Short sleep under 6 hours predicts higher muscle loss risk, sarcopenia risk, and faster muscle loss over 4 to 6 year follow-up. So get good sleep. Sit less, move more. I mentioned the treadmill earlier, as far as if you have a desk job. But if you don't and you have the freedom, you get up, go walk, go for a walk. But get up and move your body. Long sedentary bouts double muscle loss odds. Increasing daily movement preserves appendicular lean mass, in other words, skeletal lean mass. Omega-3s, 2 to 3 fatty fish meals per week or 1 to 3 grams of purified EPA DHA daily. If you're looking for a good one, check out our Omega Max. You can pick that up at Gluten Free Society. But omega-3 supplementation with resistant training augments gains in lean mass and muscle quality in older adults. Power and speed work. Add 1 session per week of fast or lighter one rep movements, medicine ball throws, kettlebell swings, or isometric wall sits. Again, wall sits, you don't need equipment. But this is just going to be more of a calisthenic / strength training. And that high velocity preserves type 2 fibers and rate of force development, which is crucial for fall prevention. So if you're getting dizzy or you're discoordinated, this is going to help with that. Avoid severe calorie cuts. A lot of people want to lose weight. Your goal shouldn't be to lose weight. Your goal should be to build lean mass. If your goal is to build lean mass, you will lose weight. That's the kicker. If you're overweight and you build lean mass, you're going to lose weight. So if you try to do calorie cut diets and you go too aggressively, you're actually going to create more problems. A good way to think about calorie reduction, so 3,500 calories is equal to 1 pound of fat. So if we divide 3,500 by 7, we get 500. Why 7? Because there's 7 days in a week. So if we want to lose 1 pound of fat a week, we could reduce our calories a day by 500. But that, for many people, that's too much. You're going to end up with muscle loss because you're not eating enough to maintain what you have. So what I recommend instead is you take this because you need to drop 500 calories per day to lose a pound a week. But instead of making it 500 calories of food, let's just do 250 calorie reduction from food. And then if you're exercising, 250 calories worth. So exercise, and this is food. And when you combine the two together, you get 500 total calorie reduction, which is going to relatively predictably help you lose about a pound a week. Now, if you're trying to figure out how many calories a day you should eat, there's some really simple tools online that you can access. If you just type in a search engine, just type in BMR calculator. And there are a couple different scientific equations that have been developed to develop BMR. BMR stands for basic metabolic rate. This is just the speed or the quantity of calories your body burns at rest. And if you know the answer to that, and then you know how much exercise you're doing, you can estimate your calorie need if you're trying to get more meticulous about it and you actually want to count. It's what some people sometimes refer to as counting macros. Now, not everybody wants to count macros. I always recommend a 7-day count just so that you can establish some baselines and have a greater understanding of the quantity of calories that are in the food that you're eating so that you can be a better judge quantitatively of what that looks like. Because again, our society is so warped in their thought around food. And it's very easy to way overeat at just one meal if you're eating at a restaurant and they're hiding butter and sugar in all the recipes. Some simple exercises and ideas and patterns that you can do. So these are things that don't really require equipment, that should take away any excuse that any of you have in terms of time. But you've got a number of different I've got here familiar calisthenic moves, right? So wall push-ups, or kitchen counter push-ups, or knee push-ups. These are kind of scales toward push-ups. So if you can't do a full ground push-up, start on the wall, go to the countertop, go to your knees. It's a progression over time. Upper body pulls, door frame rows. You can use resistance bands, timer on the doorknob, and you just pull them to you, and it'll help build some back and shoulder muscles and biceps. Lower body strength, chair, sit to stand. So depending on your level, this may be too reserved for some of you. Some of you may be more fit than this, but I tried to make this for people that were the least fit, and that way you could start from something that was aimed at what you can do. So anybody can sit in a chair and stand up repetitively. And if you can't do that, you need to be practicing it. So body weight squats would be another thing where you don't use any weight. You just squat down and stand back up, or standing lunges. And if you can't do standing lunges on your own, you can hold onto the wall or you can hold onto a chair and assist yourself. Hip and glutes. So this is your hip muscles, your glute muscles. Try lying on your back and doing what are called glute bridges. And those of you who maybe want to take a screenshot of this, because any one of these exercises, you can look them up and get pictures or videos of what it looks like to do these. Same thing with clamshells and a mini band. Core stability, planks. So you can do plank holds on your knees. You can do regular plank holds. You can do dead bugs or arm leg reaches. For power and balance, sit to stand and calf raises. So it's just tiptoes, right? That's pretty easy to do. Step ups onto a 6 or 8 inch step. Low impact cardio, marching in place, standing, cross punches. Mobility, cat camel, that's where you just arch and extend your back on all fours. Standing chest opener and ankle circles. So all these, again, real kind of simple ideas for you. These are pattern ideas. So when it comes to exercise, it doesn't take a lot of time. You're going to see in these different patterns. So like in this example, EMOM, that stands for every minute on the minute. So, you set your timer for a minute. And in that minute, you do 5 wall push-ups, and then you rest for the rest of the time. So if it takes you 20 seconds to do some wall push-ups, then you have a 40-minute rest, and then you repeat that for 5 to 8 rounds. So it's approximately 8 minutes. It's not a lot of time. It's not a lot of tremendous effort. Again, this is very elementary. You can go up from here. 30-30 intervals, 30 seconds of rows, 30 seconds of an easy march, and you repeat that 6 to 8 times. You can do a 3-2-1 ladder. 3 squats, you rest 20 seconds. 2 squats, you rest 20 seconds. 1 squat, rest 60 seconds, and then repeat. Do 3 to 4 ladders. Supersets, 10 bridges, 10 clamshells, 60 seconds of rest, do 2 to 3 sets. You see, these are just patterns. One of my favorite is Tabata. Tabata is basically, it's a 4-minute exercise. In this one, they call this a Tabata Light, which is you do 15 seconds of exercise followed by 15-second rest break. So with a Tabata, you typically pick one exercise. So imagine you're picking a push-up. You do push-ups for 15 seconds, and then you rest for 15 seconds, and you do 8 rounds that way for a total of 4 minutes. Now, if you want, this is Tabata Light. If you want to go Tabata, harder Tabata, then the pattern is 20, 10. You take 20 seconds of work followed by a 10-second rest. So you'd be surprised how challenging this can be. It doesn't sound like it might be that hard, but it's super, super challenging. 1-minute flow, 30 seconds of alternating step-ups, 30 seconds of rest, 5 rounds. Simple circuit, 40 seconds of marching, 20 seconds of rest, 40 seconds of punches, 20 seconds of rest. You can cycle it for 10 minutes. Or 5x5, slow breaths in each stretch, 5 different stretches. Again, these are beginner ideas for you guys, just depending on where your level of fitness is. If you're above and beyond that, you probably didn't need these beginner ideas, but everything can be modified up. But it's important to have a place to start. So if you're nervous and you think, gosh, I don't want to injure myself, these are some really easy patterns. These are some really easy categories that will hit multiple different areas. And then over here, there's some safety progression tips that you can check out as well. Screenshot this for later reading, but these are all things that you can do to help you, begin the process of just getting some muscle growth and building some lean mass. So there you have it, folks. Exercise, build the muscle. The muscle produces endocrine chemicals called myokines. These chemicals have anti-inflammatory properties that affect your brain. It affects your kidneys. It affects your adrenal glands. They affect your fat cells. Muscle affects your bone and your heart and your blood vessels. It helps so many areas. If you just pick exercise and do it consistently, you don't have to kill yourself to do it. The benefits outmatch any cluster of drugs you could ever imagine taking. The benefits is that you don't become a burden to those around you when you lose your mind and lose your physical capacity, because as you age, you're maintaining your muscle and maintaining your physical capacity, which is everyone's goal. Nobody wants to be around and not be functional, and nobody certainly wants to be a burden on the people they care the most about in the world. So look, I hope this class was helpful for you. This is Dr. Osborne with the Dr. Osborne Zone saying have a fantastic day, and we'll see you on Tuesday for a live Q&A session. So bring me your toughest nutrition questions, and if you have exercise specific or muscle specific questions, come back to Thursday at 12:30 and we'll get those questions answered. Take care.